Good afternoon. This is Reagan Carter, and welcome to My Health, My Life, Planned Parenthood's public affairs program right here on WBOK. I am very excited about today's show. We're going to be talking about topics that are very close to my heart, sexual health and sexual health education. I've been working as a sexual health educator and in the field of reproductive and sexual health for over 15 years, and I understand the importance of sexual and reproductive health education. Joining us for today's discussion are two sexual health educators that I've worked closely with for over a decade, Darrius Hughes and Angelita Brown. Darrius Hughes is currently a health educator in Louisiana with Planned Parenthood. Angelita Brown is currently the community education manager also with Planned Parenthood in Louisiana. Thank you both so much for joining us today on My Health, My Life.
Thank you for having us.
Yes, thank you, Reagan, for having us.
Angie, please tell us about the work that you do here in Louisiana.
The work that I do is primarily around educating parents, youth, and also community leaders and stakeholders in the topics of sexuality and health education, and as well as working with them in trying to improve not only education but also communications among parents. We want to be able to provide information that the providers of care, whether they are teachers, educators, social workers, coaches who are actually working directly with our youth, that we can actually provide them with the education that they need in regards to health sexuality.
Thank you so much, Angie. Planned Parenthood is so lucky to have you on our staff. Darrius, tell us about your work in Baton Rouge.
My work in Baton Rouge includes working with several different community agencies that serve youth, along with talking with the different community-based organizations and their staff. We also reach out to the parents of those, the individuals that they serve, as well as doing education with different student groups. To name some, for instance, I work with a youth group at Heart. In addition to that, Carville Job Corps Center, as well as Baton Rouge Youth Coalition, just to name a few.
Thank you so much. Planned Parenthood is so lucky to have both of you all on staff. Again, I'm Reagan Carter, and you're listening to My Health, My Life, and we have Darrius Hughes and Angie Brown joining us this afternoon. Research shows that teens are more sexually active than their parents think. By the time teens are 19, 7 out of 10 teenagers have had sex. 2,000 teens get pregnant in the United States every day. Again, that's 2,000 teenagers get pregnant in the United States every day. And teens have very high rates of sexually transmitted infections. Here in Louisiana, syphilis is rising, and specifically in the greater New Orleans area, which includes Jefferson, Orleans, Plaquemines, and St. Bernard parishes. According to the recently released Centers for Disease Control and Prevention report for 2013 STD and HIV national surveillance profiles, Louisiana ranked third in the nation for primary and secondary syphilis. Louisiana also ranked third in the nation for HIV. Darrius, can you explain to us the importance of testing and early treatment for syphilis?
Sure. First of all, just like many other sexually transmitted infections, it may be difficult for a person to determine whether or not that they are infected or what they are infected with. The only way they can definitely tell or be certain is if they seek testing by a medical professional. And with that, we know that with syphilis, as it progresses, there are different symptoms that may occur. Some may go away, they may come in different forms. However, again, it is very important that they seek medical attention so that they will know exactly what it is to get treated. Because if left untreated, then it can cause detriment to a person's body.
Thank you so much for that. One of the things that often in the community we don't know, and I want either one of you, Angie or Darrius, to speak to this, is that there is a rise in syphilis from the CDC report, in particular here in Louisiana. And oftentimes people don't realize that early testing and treatment for syphilis is so important because syphilis can actually cause death when it's not treated. Can either one of you talk to us a little bit about that?
And I think that's really, Reagan, the sense of urgency that we have in the state of Louisiana now, and that is around testing. Very similar to the HIV epidemic, and how key testing is to eradicate these various STIs that we have. In regards to syphilis specifically, we are finding that there is also a co-infection that is going along with syphilis, and that is with HIV. And so it is so important that testing be the key, because we want to get early treatment, as Darrius mentioned, because with it not being treated, then it will go into various stages and can be very detrimental to one's health. So yes, it's very important for testing. And those providers in the city are now strategizing on the best ways to do the testing, reaching out to those who may be at risk.
Thank you so much, Darrius and Angie, for that. Can you all tell us a little bit about what's happening in the community around the alarming rates of syphilis and HIV in Louisiana, and in particular in the Baton Rouge and New Orleans area?
Well, here in New Orleans, about a month ago, we actually had a meeting. It was an emergency meeting of all of the providers in the city who cared for, who provided syphilis testing, STI testing, which is sexually transmitted infection, testing for various infections, and HIV, to kind of, one, be aware that this epidemic is here in Louisiana now regarding syphilis, and two, to come up with a plan. And so we were able to, in that meeting, to kind of put our heads together and figure out a strategy on how to really approach it. Some organizations that weren't testing may be considering testing, maybe considering doing testing and treatment, because you don't want to lose anyone if you're testing and not treating.
Right. Darrius, tell us what's happening in Baton Rouge.
As far as this relates to Baton Rouge, one key thing that I have been doing is educating. And I think that's a key factor, educating those about the possible symptoms as well as knowing their risk and exposure. And the key thing is to seek medical attention again, to be tested for it, and also to provide the treatment, get the treatment that one needs for that.
Thank you so much. Unfortunately, the STI rates in Louisiana are alarming. Our state is in the top 3 for cases of gonorrhea, syphilis, and chlamydia. And what I want to point out here is that in Louisiana, there is no mandate for comprehensive sex education. Can either of you tell us how important do you think sex education is? Darrius?
Sure. As you know, this is something that's near and dear to my heart as well. And I think the primary thing first is to describe or to define what is comprehensive sex education.
Yes.
And what comprehensive sex education is, it includes age-appropriate, medically accurate information that's based on a broad set of different topics. I know that speaking with parents and certain people in the community, they may feel that you're teaching someone how to have sex. But basically, comprehensive sex education, again, is age appropriate, and it's talking to young people about not just sexual issues, but human development. Also talking about relationships, decision making, as well as abstinence.
Exactly.
So I think those things are key in first letting and informing people exactly what is being taught. It's very important because it allows the individual to be equipped with the information that they need and to be able to make sound decisions on where they want to be or where they are as far as it relates to their sexual health.
Thank you so much. Angie?
Yes, I think that it is really a disservice when we are not being allowed to provide the information that we need to regarding sex education. And I know that we actually, the law says that sex ed can be taught, but the mandate is important because it is not being taught to the extent that we would like it to be.
Exactly.
And so I think that comprehensive sex ed, one, will be able to assist us in overcoming some of these statistics that we've been talking about today. We will be able to provide the opportunity for the youth that we will be teaching to be able to not only have the medically correct information, age appropriate, but also to feel as though they are in control of their decisions because they have the right information to make those decisions. And so it's so important that our youth are informed, our parents are informed, because it's not only that we want to inform or educate the students or the youth, but we want to educate our whole community. This should be a community effort and not just targeting one particular population.
Yes, and I wholeheartedly agree with what both of you all are saying. I have dedicated my life to sexual and reproductive health, and it is just so important. I strongly believe and agree with the research that's out there that when young people receive comprehensive sex education, then they are more likely to delay their first sexual activity. They are more likely to use contraceptives when they do decide to engage in sexual activity, and it decreases HIV rates, it decreases STI rates, and it decreases rates of teen pregnancy. And it is just such an important topic, and I always like to talk about how sexual and reproductive health is a lifelong learning.
Absolutely.
It is something that you have to learn throughout your entire life.
Absolutely.
Any additional remarks about sex education? I feel like the three of us could talk about this all day.
Oh, yeah. Well, I have seen the other side of it when we don't have sex education.
Tell us about that.
And I've been to so many funerals of young people who have died of AIDS, who were not given the opportunity to learn. And oftentimes, if we don't talk about abstinence, young people don't think that that is even a choice.
Right.
And so I think having the opportunity to comprehensively teach about sex education, about sexuality, and about, this just embraces so much communication, self-esteem, decision-making skills. When we do comprehensive sex education, we cover an array of topics, materials, it's kind of about really just day-to-day life situations.
Right. And I just want to chime in on something. I was looking at a review, actually. It was dated back in November 2007. So even back then, there have been many different reviews and different research that has been done. But the National Campaign to Prevent Teen and Unplanned Pregnancy released Emerging Answers. And so this was a review of evaluated programs that show many positive results, including none of the comprehensive programs, they didn't hasten the initiation of sex or increase the frequency of it. And I know that many times people think that if you talk about it, then they will do it.
Right.
And so also with that, the comprehensive sex education programs worked for all youth populations. It worked for both genders. It worked for all major ethnic groups, as well as for those that were sexually inexperienced or experienced teens in different settings and different communities. So with the findings of these results, comprehensive sex education is very, very effective.
Thank you all so much. I'm Reagan Carter, and you're listening to My Health, My Life. We're talking with Darrius Hughes and Angie Brown, who are both experts in sexual and reproductive health with Planned Parenthood in Louisiana. Planned Parenthood is the leading provider of sexual health education in the nation. Many parents find that talking with their children about sexuality and reproduction can be overwhelming. There are many tools to help you, no matter if you've already begun talking with your children about sexuality and want to help answer specific questions, or if you don't know how to start the conversation. It's best to start talking with children about sexuality in early childhood, but it's never too late. Talking with children about sex and sexuality may be uncomfortable at first, but it gets easier with time and patience. There are many different ways to start these conversations about sex and sexuality. Darrius, please share with us some tips to all parents and caregivers out here about how to begin and broach these conversations with youth.
Well, first of all, I know that speaking with some parents or caregivers in the community, they themselves may not be comfortable with talking about it, but they do want their child to have that information. So with that, one step could be is finding appropriate information with accurate information to one give to their child. And outside of that, there are many different programs that I am familiar with, especially in the Baton Rouge area, that will equip them and give them accurate information. So for those who may feel comfortable, definitely just speaking with their child, being open and honest. A lot of it can come from just the parents being say, hey, I was a teen once, I can almost relate to what you're going through. If you have any issues or questions, let's talk about it. And just have an open line of communication.
Yes. Angie, would you share a tip for parents for us?
I think my first tip would be don't be afraid.
Yes.
Right.
The conversation can really enrich the relationship that you have. And just understand that it may not be a one-time shot. These are conversations that may go on. It's an opportunity maybe when you're watching television or listening to different music that your youth may be listening to. It's just really important to have some type of dialogue. I think we do not have dialogue because we're afraid of what the answers may be or what our young folks may respond to. But I've had an opportunity to do our curriculum, Real Life, Real Talk, with some parents, and it's actually an opportunity to get parents together, have a chat, talk about different tips, but also explore feelings and some reluctancies and to develop bond among other parents and kind of a support group. And we do it in a very comfortable setting, most of the time in homes. I've had an opportunity to work with the Hanno families here in New Orleans, and some of our partners have allowed me to also come into their homes to do it, and it's been fantastic.
That is great. If you're interested in joining the conversation online, you can follow us on Twitter at PP Louisiana, and don't forget to use the hashtag MyHealthMyLife. Between the three of us here today, you're looking at nearly 50 years of sexual and reproductive health education experience. And while we discuss the state of Louisiana with having the alarmingly high STI and HIV rates and a lack of mandated comprehensive sex education, we have experience with success stories in the work that we so passionately choose to do every day. Darrius, please share with us a success story.
Oh, wow. Let me see. Where can I start? One thing I will say, I have been working with students from Carville Job Corps Center. And for those who are not familiar, Job Corps itself some places are residential, but these are students aged 16 to 24, young adults from across the state. They are going to obtain some type of trade and sometimes even a high school diploma or GED. And so they are ones that have been tagged or labeled as at risk, and those who may not be able to get the necessary information that others may. So with that, I've worked with that organization for several years and on different levels. And I recently went to an event that they had, and one of the students that I had previously had a session with about reproductive health, she still remembered all the information that I taught her. She was able to even instruct and tell others. She led activities that we were doing on that day. So that made me feel proud, and it made me feel that I was doing my job, because if I had not reached anyone else, I knew that I had reached her, and she retained the information.
That is great. Those things are just so important. My success stories come quite often in Walmart. When I see a young lady that says, Miss Reagan, do you remember me? And I'm always looking, and I'm like, yes. And then they share how they remembered the conversations that we had, they remember the lessons, and that they have graduated from high school or they've gone on, they've graduated from college, and their success is that they achieve their goals without being an added statistic to the teen pregnancy rates. And so, every time I meet a young kid that I've done a session with and they participated in some sex education and they're so excited about attaining their goals, it's just it's just heartwarming. Angie, tell us one of your success stories.
Well, mine actually is similar to yours. It is just so delightful to be out in public, may not be involved in work or anything, and just to have a young person to come up to you and say, hey, how you doing? Look, this is what I'm doing.
Yes.
And it may not even be any discussion about actually comprehensive sex ed, but they realize that I was important enough for them to share their goals with me and what they've accomplished thus far from the experience that we had. And then also to have the opportunity to, I'm going to shift to the parents that I've had the opportunity to work with. One particular parent that I had worked with at Columbia Park, we had such a fantastic session that she brought she brought her daughter as well as 4 other young ladies to come to my next session that
amazing.
We did with youth. And her children were just as excited and engaged in the conversation. We're going to have an all-girls group. So it's almost like it's a snowball effect here. So if we go to one neighborhood, it just kind of blossoms out. And so that's why this is just exciting work.
Yes, it really is. And like I mentioned earlier, with 50 years of experience between the three of us, I know that we could talk about this for another hour. But before we close the show for today, I do want to give you, Angie, an opportunity to reinforce for our listeners that lifelong learning about sexual and reproductive health.
Oh, it's just so important. Lifelong conversations and education in regards to sexual health is so important. We had an opportunity to also talk to some of our seniors in the community, and to talk to one evening going to talk to a youth group, and then the next afternoon to talk to seniors.
Yes.
That reality really came to just kind of, it was so enlightening to see that some of the same questions that a youth may have, then a senior will have as well. Exactly. And we know that some of the STIs are also, they're not just limited to one population.
Yes.
So we want the same messages around protection. We also talk about intimacy, healthy relationships. That's a lifelong educational opportunity that we have. And so we're not just targeting one group when we're doing education. Right. And even if we're educating professionals, we want to educate them as well for their own personal use. So it's just really important that we understand that this is a lifelong situation that we're dealing with, and we want people to be healthy, we want them to be happy, and we want them to be able to make educated decisions.
Exactly. Thank you all so much, Darrius Hughes and Angie Brown, for being on My Health, My Life. Any final words that you would like to leave to our listeners?
I would just encourage any listener, all of our listeners, to, 1, get educated, get tested, know your status, know your risk, seek medical attention.
Thank you, Darrius. Angie, final words?
Well, I think that I would just like to leave this with your audience, is that it is just very important that we take care of ourselves.
Yes.
And that we're not afraid of these conversations that we're having, but that we move forward, we research, we find out what we need to find out so that we can protect ourselves and stay healthy, because being healthy makes us very happy.
Yes. Thank you so much. You've been listening to Darrius Hughes and Angie Brown. I'm Reagan Carter with Planned Parenthood in Louisiana, and you're listening to My Health, My Life.
Every Saturday night is Rhythm and Bounce with yours truly, Go DJ Black and Mild, right here on WBOK. And what's Rhythm and Bounce, you might ask? Rhythm and Bounce is for my mature twerkers and all my music lovers out there. We take all kinds of genres, from soul, R&B, dancehall, soft rock, anything, and put a little bounce behind it. So you get your two-step on and your mature on every Saturday night right here with yours truly, Go DJ Black and Mild, live inside of Rhythm and Bounce from 7 to 9 p.m. right here on WBOK. Real talk for real times.
Catch me, Reagan Carter, every Friday right here on WBOK from 3 p.m. to 3:30 p.m. on My Health, My Life, a new public affairs radio show hosted by Planned Parenthood Gulf Coast. My Health, My Life will highlight the healthcare challenges Louisiana faces and invite community partners to come on air to help us discuss solutions for making our state a healthier one. As the Senior Director of External Services for Planned Parenthood, I'm working with community partners and talking to lawmakers and people across Louisiana about how we can improve health care and health education in Louisiana. My Health, My Life will air on Fridays from 3 p.m. to 3:30 p.m. Tune into 12:30 a.m. or listen online at www.wbok1230am.com. For more information, please visit PlannedParenthoodGulfCoast.org/MyHealthMyLife.
Tune in Saturday 2 to 3 p.m. as Chief Warhorse of the Shafangta Nation Shatta Tribe presents Cooking with Chief and Serving Up History on WBOK 1230 a.m. Real talk for real times.
When it comes to the voice of the people, we're the choice of the people. New Orleans' own WBOK 1230 a.m. Real talk for real times.
This is Reagan Carter with Planned Parenthood in Louisiana, and you're listening to My Health, My Life. There are about 3 weeks left in the 2015 Louisiana legislative session. This week at the state capitol in Baton Rouge, a bill that would have provided sex education to Orleans Parish public school students in grades K through 12 failed to pass the Louisiana House floor. We are deeply disappointed that once again the Louisiana legislature has failed to provide sexual health education and information to the young people of Louisiana. Louisiana has some of the highest rates of HIV and other sexually transmitted infections in the nation. According to a recent United States Centers for Disease Control and Prevention study that mapped out the most distinctive cause of death by state, 22 Louisiana residents have died from syphilis. To have Louisianians dying from preventable and treatable STIs such as syphilis is deeply troubling to the public health outcomes in this state. This latest statistic proves that age-appropriate, comprehensive sexual and reproductive health education can be a matter of life and death. We will continue to keep you posted on the latest developments in Baton Rouge and all the ways that you can get involved to make sure your voice is heard. It will be impossible for us to serve the community without the dedication, support of our many allies. They include countless volunteers, faith leaders, community partners, community leaders, and, of course, our patients. To volunteer with us, please email lapublicaffairs@ppgulfcoast.org. Again, to volunteer with us, that email address is lapublicaffairs@ppgulfcoast.org. Thank you for tuning in to My Health, My Life. Please join us next week for our final installment of My Health, My Life, as we have a panel discussion on reproductive justice. I'm Reagan Carter with Planned Parenthood, and you've been listening to My Health, My Life. Take care and have a great weekend.